November marks National Diabetes Awareness Month, and across the country, more than 5 million Canadians live with the disease.
All right. Go ahead.
Dr. Jeremy Gilbert joins us this morning to talk a bit more about the disease and how some are using technology to manage it. Let's talk more about those numbers, Dr. Gilbert. Thank you for coming back. 5 million Canadians suffer from diabetes, and it's such a high number, and it doesn't seem to be coming down.
Right. Yeah. No, it is a high number, and it is quite prevalent. About 90% of people have type 2 diabetes, about 10% type 1 diabetes, and it's really multifactorial why there's such a high number. Part of it is diet, right? Harder to access foods that are healthy, cost of food security, challenges around exercise, and certain communities of high ethnic risk more prevalent in Canada, also contributing to the numbers.
All right, let's talk a bit about some advancements, particularly when it comes to technology in managing the condition. And one of the latest is something known as continuous glucose monitoring. Can you talk to us about that?
Sure. So traditionally, previously, people, if they wanted to monitor their sugars, they would have to poke their finger, draw blood, and see the number. Painful, annoying, inconvenient, and it only gives you the number. The advantage of continuous glucose monitoring is they wear a device that's recording their sugars continuously. And the person living with diabetes can interact with those numbers and make meaningful decisions. And it gives you the sugar value, but it also tells you if it's going up or down to prevent high sugars and low sugars.
So this enables you to kind of course correct, if you will, while it's happening instead of like later on in the day.
Exactly.
Okay.
So it empowers people living with diabetes to live a better life because they can be interactive with their own condition rather than always seeing the healthcare professional, every few months or whatever it is. Here they're living with it and making meaningful decisions daily.
And that's what I was going to ask. What are you hearing from patients about these results?
Yeah, I mean, my patients love it. You have the Dexcom G7 here. You have continuous glucose monitoring devices that are out there. And the people who are using it say, I can't believe I never had this before. What it's really doing for them is they see the impact of their choice. So if I eat this, this is what happens to my sugar. If I take my medications properly, this is what's happening to my sugar. They're preventing high sugars, they're preventing low sugars. So overall, their sugar control is better, but ultimately, they're living a better life with diabetes, which from a quality of life and stress with this condition, it really improves their well-being.
Okay, and that is all fantastic, great news. But at what point should somebody see a physician, see a doctor if they're experiencing symptoms of that?
Yeah, I mean, if they're having symptoms, certainly seeking a healthcare professional. And, it's physicians, but it's also nurses, dietitians, pharmacists. The whole healthcare team is important. And people with diabetes should seek information from reliable sources. So definitely speaking to a healthcare professional about living with diabetes, detecting diabetes, screening for diabetes, managing diabetes better with continuous glucose monitoring makes a lot of sense.
All right. As we mentioned, November is National Diabetes Awareness Month. Thank you, Dr. Gilbert, for coming in. Such important information.
Thank you for having me.
This portion of the morning show is brought to you by Dexcom G7. For more information, visit Dexcom.com.